This is Ideal Health Solutions, the podcast with Dr. Timothy L. Brown. All right, welcome to Ideal Health Solutions, the podcast where we explore real solutions to the most pressing challenges in healthcare leadership, quality, and innovation. Today's conversation is one that every healthcare executive, CIO, and quality leader needs to lean into. We're talking about the future of care and how it's already here. Wearable devices like your Apple Watch, your Fitbit, and Garmin wearables as well are no longer just fitness tools. They're detecting atrial fibrillation. They're also monitoring oxygen saturation, tracking sleep stages, and generating real-time health data that's starting to rival clinical grade insights. But here's the real question. What happens when healthcare moves from episodic care to continuous care? And are our health systems, leaders, and workforces actually ready for that shift? I'm joined today by someone who is right at the center of this transformation. Dr. Amir Rahmani, professor of the University of California, Irvine, and co-director of the UCI Institute for Future Health. With over a decade of experience at the intersection of computer science, embedding systems, and healthcare innovation, Dr. Rahmani, or Amir, is helping shape how AI and wearable technologies integrate into real-world care and delivery. And he's also leading innovation through his SaaS platform, Centralive, which is tackling some of the biggest gaps in how we actually use health data. Amir, welcome to the show.
Thank you for having me. It's a pleasure.
Absolutely. It's a pleasure to have you on now. I'm looking forward to talking through this overall conversation. I wear my Apple Watch every day. If I could work to sleep, I would, but I promise you the battery would be dead before I hit the first Z. But I'm really interested in this overall conversation because I know you're going to take us down the pathway of understanding how these wearables, this technology that we wear, whether it's the ring, whether it's the overall watch, can be used in a positive light for healthcare and how we're going to be able to see those transformations. So without further ado, let's go ahead and jump into the conversation. Wearables now detect atrial fibrillation, sleep stages, heart rate variability, and blood oxygen levels with increasing clinical accuracy. How do you see continuous real-world biometric data reshaping decision-making for clinicians and health systems, even beyond traditional clinical visits?
Yeah, that's a great question. There are multiple ways, in my opinion, that wearable data, and I don't want to only stick with wearable data, it's more continuous monitoring. It can be something that you wear, it can be a smart sleep pad that you put under your mattress, or any device. It's more like wearable, portable devices, even a smart home kind of Internet of Things devices that can help to capture certain kind of data, either physiological data, behavioral data, context, all of those things. So, and benefit of these kind of device, that the data, longitudinal data generated by these devices are manifold. One, of course, the fact that they can now provide contextual information. You mentioned about sleep, you mentioned about physical activity, actually, that's very important. So one important aspect here is, like, we know, let's say you have your lab test. You know, for example, you have already hypertension, for example, so you know already your systolic blood pressure, or you're using a CGM, continuous glucose monitor, and you know, okay, my glucose level is high, or my blood pressure is high, but what you only know at that time is what is happening to you, right? And usually, okay. But the next question is, okay, so what should I do? And unfortunately, without having enough information about your lifestyle, what's happening between visits, it's also hard to provide personalized recommendations. That's why you often see kind of generic advice, maybe patient handouts that are generic that we give to everyone, how to manage, for example, the hypertension. But a wearable device, or these all continuous monitoring devices, can help getting closer to causality, to why something is happening. Because now we know if this person, for example, has a very sedentary behavior, right, to not moving, or we know maybe this person, as you mentioned, about heart rate variability and stress, maybe it's more like a stress-related matters that actually are leading to maybe uncontrolled hypertension, because we know there is a link between all of these things. So that's one angle that is very, very important, understanding of what, a little bit more computer science lingo or AI lingo, we call it like we can build personal models, and that personal model can guide providing recommendations, providing actionable insights, because you just don't want insight, you want actionable, right? So what is happening, and that why is very strong. The other aspect is that, we all have, of course, we know the value of accurate episodic data. There is no doubt about it. We need the lab tests, we go to the clinicians, and they measure all those different kind of aspects of your body, and they try to estimate your current health state. That's what we call, right? They have all this measurement now. Your current health state is in maybe this state. It can be positive, it can be negative, whatever. But that's an episodic state. But something that is missing is, okay, this trajectory, like what is happening between these visits. Of course, we cannot have and afford those expensive, maybe highly accurate devices, clinical grade in-clinic devices that give you rather accurate absolute values. But now we have devices that may not be as accurate because of many environmental issues. Maybe, for example, you have ambient noise, motion artifacts, a lot of other confounders in real-world settings, but you have a lot of them. So the idea is that now you have volume of maybe a bit less accurate data together with a little bit of much more accurate data from the hospital. So that can, together, they can be very powerful, because now, even if the absolute values of those wearable devices is not 100% accurate, let's say, even there are these days devices out there that claim to measure your blood pressure continuously, which are not 100% accurate. We know because of many issues like motion artifacts and environmental noises, but still they're very good at capturing the change. Like the delta is it increasing, is it decreasing? So usually if they overestimate almost all the time. So but the delta would be the same.
Absolutely.
And that's very, very kind of valuable, because now at least okay, even if my continuous glucose monitor is like the absolute value is not 100% accurate, but at least I know when I eat, a bottle of apple juice, there's a spike. And the magnitude of that spike is important. So that's another very important one. You can also understand and try to kind of be on the driver's seat of your health, because doctors only have 20 minutes during the visit, or a little bit more or less, to help you, but you have all the time to better understand yourself and do this, health promotion through like self-management.
Absolutely. I love that answer. I love the two angles that you kind of taken with it. What I'm hearing you kind of say is, and what you're actually seeing in the overall field, is that we're moving from more of a snapshot of the overall patient's health to more of a, if you would call it, a full-length movie where you can see how patients are performing outside of the overall clinical environment, if you call it, where a doctor can only see you for 20 minutes and try to give you a synopsis. Now we have the ability to track your overall behaviors, your eating habits, how you're moving, your sleeping patterns, and things of that nature that really play into the factors of your overall health, which is amazing. There was a study that was published by the New England Journal of Medicine showing that these devices, such as like the Apple Watch, have the ability to detect irregular heart rhythms at scale. So whether you're exercising or you're walking or you're sleeping, they can actually detect where your heart rate has those irregular rhythms. What I also see is healthcare hasn't fully caught up to the overall capabilities. And just from your perspective, why do you think there is a gap that still exists between these abilities to track this information with the new technology and where we are currently with the stance of healthcare usage?
Yeah, that's a great point, and also question.
The $1 million question, right?
And there are multiple reasons for that. It's not just one reason, but I'll try to at least cover some of the ones from a technical perspective that are important. Of course, there are many. It's a multifaceted problem. From the technical side, one big issue, because I closely also collaborate with UCI Medical Center, and they're highly kind of progressive and up to date, and of course as much as they can. And one of the issues is that these devices generate a lot of data, and clinicians, healthcare providers are already overwhelmed with a lot of tasks. And
Yes.
even if you give that data, let's say, through, I don't know, maybe EHR or Epic or all of those other companies of the world, the fatigue that and the information kind of the overwhelming volume of information is a challenge. How we can transform a lot of time series data into events, because at the end of the day, events are what really matters. Because and you can define events. A clinician can
Correct.
an event can be maybe, I don't know, X% overshoot in your glucose level, or an event can be maybe in a sleep quality less than 60%, or an event can be a fall. The event doesn't have to be like there are different types of events, interval events, all of those types. But first, transferring data into events so that you can then start reasoning on top of those events, and because that helps you already to filter a lot of data, make them
Correct.
more meaningful, and at the end of the day, we human and of course clinicians, they also kind of are more comfortable with dealing with events because they're explainable and so on. So that's one. And then even events are not enough. I think then the next level would be, okay, now you have the events. How can we build, how to say this, some people call it digital twins, some people call it personal models. We in our center call them personicals. How we understand this personal chronicle of these participants, so that quickly we can understand and we can explore and we can provide actionable, and that can provide actionable insight. These days, even we have the power of generative AI and agentic chatbots, which is also what we do in our company and also in our research center, Institute for Future Health. In fact, we proposed one of the very first agentic AI platforms for the healthcare, open source platform called OpenCHA, OpenCHA. There's a website, opencha.com. CHA stands for Conversational Health Agents. And the idea is, okay, even if you connect now these to an agent that can summarize, can make it interactive, can help you, get the signal out of noise, that can help a lot of clinicians because now they have quickly maybe a summary. The chatbot explains, okay, I think this patient is doing this and this, last month overall his sleep quality was like this, but I noticed maybe on the days he had some, certain diet or alcohol or whatever it is. So that can help a lot because they don't have time to look at all those things. So do we need,
Absolutely.
and AI can play a big role here because you need someone to help. And if, of course, you can bring human, but it's not scalable.
Correct.
We're in a shortage of manpower, or staff, nurses. So and I think that's a part that AI not only won't replace any jobs, but also would really empower and make our, healthcare providers super human, if you will.
I love what you said, trying to get a signal through the noise, because it's not necessarily that we have a technology issue. We have the technology. We went from getting a small piece or snapshot of information, and now we have an overabundance of information. And it really is trying to pinpoint where the changes need to be done. And like you said, even though we have all of this new information, we still only have a window of time that you have the physician in the room and the patient to diagnose, to try to create better habits. So having and integrating AI into healthcare would be one of the great benefits of bringing that in to reduce the overall noise, identify those key areas where changes can be done quickly. And oftentimes what we say is to get to the overall low hanging fruit. What can we change quickly that's going to give us the biggest bang for our buck as we're trying to make those overall transitions for our patients? So, you also spoke about infrastructure too, and I want to talk a little bit about that, if we can, with these data streams from these wearables and things of that nature that are growing exponentially. What infrastructure or even culture barriers do you see preventing health systems from fully leveraging the information? I think you kind of hit this already. So if it's a reiteration of what you've already said of trying to find that overall signal in the noise, how do we build infrastructure for the technology that we now have?
Yeah, the infrastructure, building an infrastructure outside clinics and clinical, by technology companies, it's not really that hard. They have been doing it for much more complicated and much more data intensive applications already. The issue is usually more about regulatory, privacy, security aspect. Many still health systems want to have full control and have, for example, on-premise kind of an instance of the same thing, and that usually makes it hard oftentimes to to kind of make it scalable and or rapidly implementing something, because it's like every system is a separate project, a new project. Customers understand rather than just having an entire system that people can come and serve them. Let's say. That's one barrier that I've noticed, especially because, and they have the health system have the right to, of course, be concerned about, of course, the privacy of those things. But that's, of course, usually one barrier, because they don't want their data to leave their EHR to leave their private environment and so on, and that makes it a little bit hard. Building that trust, partnerships, agreements, all of those things, and usually it's a case by case. That's one barrier. There are solutions to that. For example, we tried in our platform to kind of have this layer of automatic de-identification, so that the third party, which is us, we're not storing any PHI. And when the data leaves, only the de-identified data comes to our system, even though it's HIPAA compliant. But I think that will help, but we should not only rely on being HIPAA compliant, because if there's a possibility, and if we really don't need PHI, I think third-party innovator, like the kind of special, like the industry side, can still, I think, play a big role. We're working on kind of de-identified data, but on the fly. But when they back to the platform, the provider can re-identify it and know, okay, this data belongs to this person, now I can do that. I think that there are solutions, of course, federated learning solutions, and also many other solutions, but that's a part that still is like slow moving.
Yeah, absolutely.
I would say one of the main issues, but there are multiple other reasons as well. Yeah.
Yeah. I think you're spot on with it. Like I said, it's not necessarily a technology problem, but it's more of a translation problem, and really understanding the information that's coming in. Even when you're speaking about de-identifying the data, so we're HIPAA compliant, but that shouldn't be the only barrier, or shouldn't be the only reason that you want to kind of move forward with it. There should be other ways to kind of pull it in. We don't want to always have the systems or the mindset. It's really to turn that data into action, which is what we're hoping to do when it comes down to the help of the overall patient. So if I want to shift gears a little bit and dive into innovation fatigue, because you mentioned this briefly earlier, where we're implementing new systems all the time, and it happens in an organization, especially in healthcare. We hear, oh, we're going to change to Epic, or we're transitioning to this overall system or that system. And you get the eye roll when it comes to technology implementation in healthcare. So looking at overall leadership reality for a second, many healthcare CEOs are dealing with what we call innovation fatigue. They're balancing modernization, cybersecurity threats, staffing shortages, and really those budgeting constraints all at the same time. So when it comes to that, When it comes to AI-driven wearable integration, what should leaders prioritize first from your perspective?
Leaders, I mean, just to clarify, from the leaders, like from the industries, like the innovators or leaders from the health systems, like the chief information officers that they want to adopt technology. Just understand which one you're more referring to. The adopters of technology or the providers of technology, like this. The CEO.
I would look at it from the leadership of your decision makers. So they're going to be like your CIOs, your doctors that are implementing this overall technology for their teams.
Yeah. That's a hard question for me because I never kind of served as on that role. I would prefer having dealing with an ecosystem rather than having like this guy. How because there are, for instance, there are companies that try to orchestrate some of these solutions. For example, even let's look at Amazon, like AWS. There are many others. Like they try to offer many of these services through like a marketplace, something that you don't need to directly kind of deal with individual innovator, but you have this ecosystem that you can try, and it's kind of already safe, like something that smartphones, like Steve Jobs of the world did. Like they had no apps, right? You're only really dealing with App Store, but you can try. Okay, this good. You're not dealing with each and every kind of game or app build provider or something like that. So that having this idea of a marketplace that you can try, you can look at the ROI, you can pilot. That will help because then you can you're not, because there is of course onboarding and all of those other kind of efforts, and that's
correct.
Time. It takes energy. It takes a lot of things to test this, but a lot of that is even unnecessary, like the legal parts, like all of that. Okay, but if there was a way that you could just try an error, right? Okay, let me try 50 patients with this program, and let's see which one works without going to someone else's. There is a middle, a trusted middleware or trusted broker, or whatever you want to call it. I don't have a good term for it that can help. I would love to have something like that so that I can quickly try in my system and decide what works best. And also, of course, having a good level of flexibility and configurability, so that because every system is different. They have
absolutely
can't just also. It's not like an app that easy that everyone will download and start using. They need to, and I think AI agents these days can help with that because they're very good at understanding what you need and on the fly kind of automate the workflow and make it more, help the translation of it into your own kind of environment. Like, because, part of that can be automated. But one thing that maybe a little bit not fully answering your question, but still I wanted to share that is, this is just an observation, maybe anecdotal. But I've heard it from multiple people, so at least I have it. It's not a sample size of a few samples of people. One issue is that I see a lot of interesting innovation happening at startup levels. Okay,
absolutely,
of the world and so on, and they are much more appealing than sometimes what a bigger, kind of a more well-established company that everyone knows the brand or everything offers. But the issue is that in healthcare, trust, or even I shouldn't call it even trust. It's more like reliability of like whether they know that this startup is going to be around for a few years or what's going to happen. So that part is like maybe trust is a good word. The CIOs or the hospital level, they're not really giving enough opportunities to smaller companies to kind of showcase, to innovate, and they rather to go with a little bit like less innovative and maybe old-fashioned technology, but offered by a bigger player that they know in a few years is still going to be around.
That's correct.
So that is also a problem. I don't know how we can solve that, but I think there has to be also a way, because I see a lot of these smaller companies, new players. They have amazing ideas, but they can't, and they are knocking doors at different health systems, and they can't just get in because that part is hard for a
You're
small.
absolutely right.
Yeah, even though they're offering something astonishing. So just wanted to that also mention it, because I think that's important. Yeah. So
The point that you're bringing out is you have a lot of players that are new. You have innovation that's coming out that could potentially change and will potentially change how we do healthcare. However, because they're smaller, they're not as well known. They don't get the recognition or the ability to kind of play in the big pond if you want to. You have your big players that own every piece of technology, or at least have the name and the overall reputation that is that stands out. So they're oftentimes able to get the business that these smaller organizations aren't able to. And then, oftentimes because they're so small, they either shut down or they're consumed by a larger player. And then that overall technology that they bring out is either watered down or it's just completely, deleted or removed. So I see that often with a lot of new players in the field, especially when it comes to AI, when it comes to quality and quality control for healthcare organizations and things such as wearable technology. That is an issue that I see often, and I'm hoping that there will be a way for these more innovative, and we're not calling the other places uninnovative, but we know that there are some technologies out here that can really transform how we do healthcare and how we can push it forward. And I'm hoping that this platform will open a door to leaders that want to look outside the main key players. And I'm not going to call their name, but we all know them. If you work in a large healthcare system, I'm sure you know a few of them. And oftentimes, if you ask around, your employees will really tell you how they feel about these overall organizations, not necessarily in a negative way, but many of the issues that they face have been fixed and have been solved by smaller, less prominent organizations. And if given the chance, given the opportunity, they can really dissolve some of those monotonous issues that we see when it comes down to quality, data issues, and also AI integration as well. So I appreciate you bringing out that point. I think that's a very great point, that those resources are available. They just need the chance and the opportunity to share that with the right players, and the chance and opportunity to validate what they're bringing into the healthcare system.
absolutely. Maybe one solution could be having more of kind of pilot opportunities. That rather than you are trying to find a big player to take over, or kind of to take care of all of your patients, maybe for remote patient monitoring or something like
Correct.
that. You can try and see, and sometimes even building partnerships with them, because if they also know that for the end, like if that works, and if they have a strong partner like one health system, I think that's already guaranteed that they're going to survive, because they already have a big or reasonable customer base. But I think that something like that would be interesting, and maybe also government can help with some federal funding. I know.
I agree.
RPH, I think maybe building that kind of trust and connection, like maybe it needs also some help from outside.
Yeah, I know. I totally agree with you. Having some type of funding, I love that, the idea of bringing in the government to see if there's way to set aside funding. I know we're having a lot of issues right now with funding overall in the government, but having that opportunity to bring out new and innovative ways of care and how we're promoting for our patients, I think it's going to, number one, save lives, save millions and billions of dollars as well, because we are bringing in the ideas that are needed to solve many of the issues that we see every day within our healthcare system. So that is definitely an idea. If it goes through, you heard it here first. Amir was the one that brought the idea out, so make sure he gets the payment for that across the board too. I'll take my supplement for that as well. So we're shifting gears. Exactly. I want to shift gears a little bit and talk about chronic disease and public health or population health. Wearable adoption is rising, especially among the older adult population. And population health programs are increasingly integrating remote monitoring. What roles do you believe continuous data will play in chronic disease management over the next 5 to 10 years, if you say?
I think one big shift can be like more personalized patient education. Because,
Absolutely.
you monitor, but you also, the coaching part usually needs, currently needs a lot of time and effort from like a clinicians or nurse or someone in the loop, a human in the loop, right?
Mm-hmm.
But I think being able, combining the power of continuous sensing or monitoring, which comes from these wearable portable devices, and the power of large language models, agents, AI, that can work in tandem and actually now provide personalized coaching and also personalized advice in education can really help the individuals, that patient, artist, or person, to better understand themselves, better understand, okay, what works for me. Maybe my problem is not really kind of the problem with my glucose is not my diet. Maybe it's just my sleep is not really high. We know all of these, but we don't have objective data, and we have hypotheses. But sometimes we have even incorrect hypotheses that I think that, but when you look at the data, you see, no, that's not the reason. So I think this can help us, as I said, to better understand what's happening with us and what works and what doesn't work, and be more, how to say, specific and personalized. So that's a
Absolutely
big deal in my opinion, and also empowering because now we can we know already many people go to the chatbots and in these AI agents and ask for advice, mental health, physical health, all of those. And of course, they receive generic advice. Sometimes also, of course, it can be hallucinated and all of those things because maybe it's just a general purpose chatbot, not a specialized chatbot.
correct.
When these tracks more, how to say, converge, and we have more of personalization and personal data connected to these AI agents. It doesn't have to be wearables. Now the AI agents can also connect your my chart and look at your lab tests, and because you have the data that you own, right? So you can connect all of those things. Google and Fitbit and some of them have APIs now that you can even connect your EHR. So that's going to be very powerful. And I think in the future, if we can really try to have this convergence, and kind of the coaching can be more effective and personalized, because we know one reason that adherence drops because the recommendations just don't work for me or you. I was part of this research and looking at how we can connect, in addition to these sensor data, other modalities. For example, just connecting the data from your membership, from your shopping cart, like Costco membership. I'm just
saying that
everyone needs to have one. Now you know that what this person is even buying, like accessibility, like their socioeconomic status, because not everyone can afford anything. And that data is doesn't need to be logged. It's already automatically generated. Now you have that type of multimodal data coming, and do you see the power of this agent get to know you very well and can really help you do things that really matter? Because at the end of the day, you may have all the information, all the technology, but the human element at the end and the adherence to that is usually the hardest part.
Yeah, absolutely.
Use the data and the agent to kind of really improve the patient engagement. That's kind of another thing that I think in the future, hopefully we'll see more of these things happen.
I was gonna say, I love that you're bringing in understanding how the overall patient is consuming and being able to understand where there are real gaps when it comes to their overall healthcare. So, I can say I'm exercising, I can say I'm eating healthy, but now we have the ability to see For sure, if I am eating healthy, if I am exercising, if I am doing what I say, because then oftentimes that leads you from just seeing the information to actually being able to physically be in there with the overall patient, at least from an AI standpoint, and be able to transform and change how they kind of move forward with their overall health. But I like that you're going to be scaling across the entire population. That's really the next frontier of it, of integrating this technology. But you mentioned something earlier too that stuck out to me about AI and the overall workforce, where we can now see things such as a person's Costco shopping list and things of that nature. And you also earlier mentioned how AI could really help us kind of see through the overall noise of what's going on. But there's a growing anxiety, I believe, across the healthcare workforce about AI and replacing jobs, not just in clinical roles, but more of the administrative and analytical functions. What's your realistic perspective of AI as we're transitioning into this stage in this era of artificial intelligence? Where should leaders be concerned and where should they be more optimistic?
Because I'm not a clinician myself, I'm a professor of digital health, a technical person, like with a technology background. I've collaborated a lot with, clinicians, doctors, nurses, and so on, but I haven't been part of that. So that's why I'm maybe not the best person to comment on the AI workforce within clinics or in clinics, but what I can comment on is more like what's the outside of the clinics in everyday settings, the role of AI. And in my opinion,
Correct.
the gap there is big in the sense that you're not trying to replace anyone because there is no one doing it. There's a gap like that. It's like a void.
Correct.
What's happening is because no one has time, even in the health system, to spend that much time with you to kind of coach you and all of those, unless you have a very high-end concierge medicine, whatever. But I'm talking about like a population mass. There's a gap, and so far we couldn't even afford to put human because we can't just afford a one-on-one for everybody and so on.
Okay.
So that's why you see AI to fill that gap and create services that wasn't even done before, not by a human. So it's not replacing, it's creating something totally new. Some services that we always wanted to have, but because of scalability and manpower issues, we couldn't do that, right? So, and that's why I'm not concerned about it because no one is doing it anymore. So that's why I would say I'm optimistic because the part that I'm focusing on, it's not done by human.
Correct.
So let's find an AI at least to do it if we cannot bring. Yeah.
I like your perspective on it. You say it's creating jobs that we're not able to physically do now. So we're not necessarily trying to eliminate jobs. What we're trying to do is get deeper into the data, understand it better, provide better diagnoses, provide more information to help the patient move in the right direction towards their overall health. So a lot of this is not available, it's not accessible unless you have an absorbent amount of money or a budget that's out of the world. But what we are creating is opportunities for us to level the playing field for healthcare when it comes down to providing better care to our patients. So looking at it from that standpoint, you are absolutely right. We're not necessarily looking at eliminating jobs. We're looking at making the jobs that we have that much better with the assistance of AI versus eliminating the monotonous jobs that many of us don't really want to do anyway. So in the healthcare industry, so I look at it from that standpoint.
And to clarify, I'm talking about that continuity, right? So there's something also next episode. What's happening in between? There's a gap. No one else is doing it. You can't have one-on-one coaching, but AI can help us now be that coach and fill that gap with maybe a supervision, like a periodic supervision of a domain expert, but not every day. We can never have that type of continuous daily coaching for everyone unless we bring some automation and AI to the picture.
Absolutely. Well, look, I only have one more question, and then I want to learn more about what you're doing with Centralive and things that may be coming up for you as well. So the final question is always a broad one when we're looking at future skills that are coming for leaders across the board. So for emerging healthcare executives or quality leaders listening today, what skills or digital competencies will be non-negotiables as these AI wearables and AI systems become foundational across our overall care settings?
You mean the skills that still need to be performed by human?
That's correct.
Yeah, I think that the oversight and supervision is key, right? And the fact that AI doesn't have this a sense of agency, at least
Mm-hmm.
currently, and maybe not in the near future, and the fact that you need you need humans that are critics, that they can go beyond what they have learned and kind of help you explore and not just play, sometimes not play too safe, not sometimes not play
Mm-hmm.
unsafe, all of those things. So you need that kind of human sense of agency, people that are like still understand the big picture and so on. I think that's important.
That's good.
And also the availability to knowing the pace of new technology being introduced is overwhelmingly hard, even for me as a person that they every day actively
Mm-hmm.
tries to keep up. I mean, in the university, outside university, but still, it's like I'm overwhelmed. Get anxious sometimes. Yeah, so things can become quickly irrelevant. So that makes the importance of continuous development, learning, R&D much more important because, and that will pay off
Okay,
because
so I want to talk about Centralive. Can you tell me a little bit about Centralive and the premise of the organization and how you're helping to transform healthcare now?
that's yeah. So Centralive is a product that we a platform we started designing at the university. And it was a platform for a few years only available to our researchers at UC Irvine. But we turned it's now a spin-off from university. It's a product to help you quickly build solutions for real-world settings. Mobile health, digital health solutions. You need device integration. You need build quickly a mobile app for your self-reported or patient-reported outcomes. Also kind of maybe quickly building an intervention, just-in-time intervention. For example, you want to send an educational video on maybe sleep hygiene, and you want to only send it on the mornings following a poor sleep quality reported by a smart ring. And that usually takes a lot of, you need for implementing like that, you need a custom software and app that will cost you like hundreds of $1,000s. But with Centralive, without any coding, you can quickly prototype that. And it helps a lot with both researchers and also innovators like startups who want to follow the lean startup model. They want to quickly prototype, check, to customer discovery, and kind of see what brings the value and so on. So Centralive works as a SaaS product for that, like quickly developing. It's a no-code platform to quickly build health solutions. We've already integrated many devices. On the other hand, Integrated AI Systems has this second product, which is called Livi, L-I-V-E. LIVI, Livy, and that is an AI agent builder platform. Now let's say, and that's Centralive and Livy are connected. Sometimes you only want Centralive, sometimes you only want Livy, but sometimes you want a solution that has both of them. And it goes back to what I mentioned, like you want to build quickly an AI agent that is connected to these real-time data, multimodal data. And you want to also kind of customize it. For example, you want to put safety guardrails, saying that, okay, I want my chatbot to use maybe a certain open source LLM, maybe, I don't know, MedLlama or whatever, or Gemini as an LLM. I want it to be connected to my sources. For example, I'm a provider. I have maybe patient handouts, certain information that I connect to my chatbot. I want maybe my agent to also connect to the data coming from continuously being monitored by this, for example, by Centralive, or maybe other platform. Maybe you have your own EHR that you want to connect to the agent. And also the place that you can define your constitutions. You can define your rules. For example, you can say, in my chatbot, I never want to prescribe medications. I never want to diagnose. I only want to provide, for example, coaching with certain rules. So you can all define all of those safety guardrails, all of that, and on the fly, it will generate a kind of agentic chatbot for you.
That's
so these
awesome.
are the two platforms that a company integrated AI system owns, and we're actually continuously developing. And Levy is based on an open source platform I mentioned, openchild.com. The open source version, of course, is available to everyone, but we have our own proprietary version. It's more like a service. As a code, this is a service. So both of these are services, like platforms. Centralive and Levy are services running on cloud that can help you quickly prototype and implement mobile health solutions, interactive chatbots, agentic architectures, and so on. That's actually what we do. And the more and more we're trying to kind of our vision is how we can bring this continuous personalized coaching, and having these two at the same time can help bringing that into the picture.
So if someone wanted to get in contact with you, what's the best method to connect with you?
Well, my personal email is one, of course, the easiest. It's my last name at you can use centralive.health. That's one. Rahmani@centralive.health is one way. Or they can just go and submit a demo request on our website, the website you already see on the screen. They can go there, submit. We have a calendar they can book, and I'll try to show up myself, or they can even put a note that they want to speak with me. So that's another possibility. I think that's the easiest maybe way, just to either emailing me directly or just submitting a demo request.
Absolutely. Well, look, this has been an incredibly insightful conversation today. And before we close, what's one thing you want healthcare leaders to remember as they think about AI, wearables, and really the future of overall care from your perspective?
I would say focusing on why, not just what.
Yeah, that's good. I love that. Focus on why, not just what. Because oftentimes we have so many things that we could put our energy in, but why are we really doing this? And hopefully it is to improve the care of the patients that we serve, the communities that we serve every day. So if there's one takeaway from today's conversation, it is the future of healthcare isn't coming. It is already here. The question is whether we're prepared to lead it. To our listeners and healthcare executives, quality leaders, and those aspiring to shape the future of this industry, this is your moment to lean in, build new competencies, and lead transformation with intention. Thank you for tuning in to Ideal Health Solutions, the podcast. Make sure you subscribe, share this episode with a colleague, and continue with the conversation. Until next time, keep leading, keep innovating, and keep pushing towards Ideal Health Solutions. If you enjoyed today's episode, be sure to follow Ideal Health Solutions, the podcast, wherever you listen. You can also connect with me on LinkedIn for more insights on leadership, health, and transformation. Until next time, stay inspired, stay focused, and remember, even in uncertainty, there's opportunity.